Hi, it's Dr. Mike, and the title of today's video is Fibromyalgia X-ray. And basically in this video, I'll be discussing some of the things that we see on X-rays for fibromyalgia sufferers, and also at the end there'll be some specific information as to whether an X-ray is useful for someone who has fibromyalgia or not. So I hope you enjoyed it. Please note, this presentation is not intended to provide individual patients advice, but rather it's a way of providing education about fibromyalgia. If you think you have a condition that is causing you chronic pain, please talk to your doctor and get a proper diagnosis and treatment plan. So to start off, what causes fibromyalgia? The cause is currently unknown. There are genetic and environmental factors involved. There is research that's ongoing. But the general consensus is it's a disorder of central processing with neurotransmitter or neuroendocrine dysregulation. Basically, that just means the way that your brain senses and feels pain, the way that the brain chemicals work is kind of unbalanced or out of whack, and as a result, you experience pain, abnormal pain messages. So some of the causes that have been identified, amongst others, the HPA axis hyperfunction. The HPA axis is basically related to the hypothalamus, the pituitary gland, and the adrenal cortex. These are glands in your body and parts of your brain that control how you react to stress and how your stress hormones are released. And there seems to be a decreased function there. And we also notice functional changes in how the immune system works, and there are also some changes in neurotransmitters and even some digestive changes. So there are a wide variety of theories as to the causes. There are no overt destructive inflammatory processes in the condition, and no consistent structural changes. So when we look at fibromyalgia tests, there is not one specific test that diagnoses fibromyalgia. It's a diagnosis by exclusion. That basically means if you've tested for a whole lot of other things that could look the same as fibromyalgia and none of the tests come back positive, what you're left with is fibromyalgia. It can be a lengthy process of ruling out the other diseases and medical conditions. And also, the diagnosis now is mostly made using diagnostic criteria, meaning they have a group of symptoms and signs that are grouped together. And if you have a whole lot of these, then you are going to be diagnosed with fibromyalgia. The laboratory testing and blood testing is used either to rule out other diseases which may be causing your symptoms, or diagnose diseases occurring at the same time as fibromyalgia. So when we look at the X-ray and what it means to fibromyalgia sufferers and how it's used, X-ray imaging identifies structural bony changes and disease processes. So when we're doing it, we're basically getting a look at what is the structure of your bones. Are there any changes to your bones in the shape and the size and the way that they look? And these may often be normal in fibromyalgia sufferers. The X-rays do help to identify other causes of possible pain. That's why they're commonly used as one of the first tests with fibromyalgia sufferers. Obviously, if you have musculoskeletal pain, one of the causes could literally be from some kind of bone arthritic process or something going on with your actual bony structures. And if it comes back normal, then it can often be said that, well, we've excluded a whole lot of bony problems, and this could be the early stages of something else. So often X-ray changes are not included in the diagnostic criteria of fibromyalgia, and the same applies to other imaging such as MRI, CAT scans, or ultrasound. So I hope that informed you a little bit more about how they use X-rays with fibromyalgia sufferers. Please check out my next video in the series called Fibromyalgia, Diagnosis of Exclusion, where I go into that a little bit more in depth. And if you're interested, you could sign up for the 10-part fibromyalgia mini course. There should be a link in the description or in the comments section. And feel free to comment, like, and subscribe to my channel. So hope to see you at the next video.